Hi everyone, welcome back. So this is a video regarding PLAB 2. I intend this video to describe more about PLAB 2, to give you a general overview of how PLAB 2 exam is taken, what it means, the general structure, booking, costs, things like that. So if you are someone who would like to give your PLAB 2 examination or someone who's just interested regarding PLAB 2, I suggest you follow along this video. I will also try putting a timestamp below so you can quickly jump into the required topic. I will not be covering any preparation details about PLAB 2 in this video because that's just going to make the video very long. Well, now PLAB 2 exam is an OSCE exam, which means it's an objective structural clinical examination. I know that sounds a bit too much, but let me try explaining what that is to you. Now, PLAB 2 examination is an OSCE examination, which means that they're going to try to create as much as possible a real life scenario in that exam hall. This is the best way I can explain the examination. So imagine you have a cubicle, you walk into it, and you may have a patient, or it could be a telephonic consultation where you have a patient's voice alone, or it could be a videographic consultation where you have a TV in front of you and the patient is on the other side of the screen, and you talk to the patient and you carry out a simulated real life consultation. What the examiners are trying to see is, how do you deal with your patients when you are placed as a junior doctor in a hospital? How do you deal with them? How do you manage your patients? How do you address their concerns? How do you carry out the procedures? Are you a safe doctor? These are the things that the examiners would like to see, and this is what the entire purpose of PLAB 2 examination is. So again, let me just reiterate, the entire purpose of the examination is to create a clinical scenario where you are a junior doctor, and as a junior doctor, how do you deal with your patients? How do you manage your patients? This is what, in short and in simple terms, this exam is all about. Now, those of you who have taken your PLAB 1 exam, or those of you who may have an idea about PLAB 1 exam, know that PLAB 1 exam is a pen and paper exam. It's an MCQ exam. You just sit down in an exam hall and you just mark the correct answers. However, PLAB 2 exam is very different from PLAB 1 exam. It is an exam where you physically have to go into a room and you will have to deal with your patients depending upon what is asked of you. So each station is going to be different. It's not going to be the same in each station. So that can differ depending upon the task that is assigned to you. How do you do this? I will come to that in a bit. But I hope you now understood the difference between PLAB 1 and PLAB 2. PLAB 1 is very theoretical. PLAB 2 is not like that. It's an OSCE examination. So when can you book your PLAB 2? You can book your PLAB 2 as soon as your PLAB 1 results are out. And you need to make sure that you take your PLAB 2 exam within 3 years of your PLAB 1 results. You can either book it immediately, or you do have a time period of 3 years from PLAB 1 results to give your PLAB 2. So the cost of this exam is £906 as of April 2022. Where do you take PLAB 2? PLAB 2 can be taken only in UK in Manchester. There are 2 centers for PLAB 2. One is Hardman Square, the other one is Hardman Street. Now, one thing to bear in mind is there are 2 slots, there are 2 batches per day. One is the morning batch examination, the other one is afternoon batch. So the only thing you can book is a date, which center you give your examination in, Hardman Square or Hardman Street, and the timing of the examination, the morning one or afternoon one, would be assigned to you by GMC. This is not something you can choose. All that you can choose is the date of examination. How to book the exam? It's pretty much similar to how you booked PLAB 1. You need to go into the GMC website. In GMC Online, you log in to your portal using your GMC registration number and your password. On your left side of the screen, once you log in, you will see My Tests, where you get to see PLAB 2 and you can book in a similar manner, book PLAB 2. Next, let's talk about some things you need to keep in mind before booking. One thing you need to be ready is with the fee. The fee is 906 UK pound as of April 2022. Second thing, which is very important, is the visa processing time. This exam is given in UK and you definitely need a visa before which you would be allowed to travel to UK and sit down for the exam. So you need to make sure when you book, the way and the month you book or the time you book would also consider the visa processing time. I usually say do give a time of 2 to 3 months. However, there are some countries which does give out premium visas for which you have to pay extra. However, it will fasten your visa, but I'm not sure if all countries have it. So to be on the safer side, I would say give it a 2 to 3 months period before which you're ready to sit down for PLAB 2 exam. And how many attempts are allowed in PLAB 2? You have 4 attempts for which you can take for PLAB 2. For a 5th attempt, you will have to show them that you have been working for 12 months. Now let's talk about the cancellation fee. If you have a good reason to cancel, they usually refund you the entire fee, especially if it is pandemic, some illness, or some visa reasons. Usually they're very accommodating. But otherwise, the cancellation fee is if you cancel before 42 days of examination, say there's only 42 days remaining for the examination, they charge you £90 as the cancellation fee. If it is within 42 to 28 days of the examination, it is £453. If it is less than 28 days remaining to the examination, then you have to pay the entire amount. That's £906. You really don't get a refund. But they are usually but if you do hold a genuine reason for which you're canceling the examination, any of those lockdowns or anything like that, they're usually very accommodating, and you can actually email them and explain your situation. Now, PLAB 2 exam is a 3 hours long exam. And in this exam, you have 18 stations. Before we go ahead, let me please clear what station is. Each station, when I say the word station, it means cubicles. So when I say there are 18 stations, you have 18 cubicles. Now, each station is 8 minutes long. That means in each cubicle, you may have a patient or something to deal with. The time given for that task is 8 minutes. So you have 18 such stations, out of which 16 stations you will have a patient or a task to deal with. 2 stations is a rest station or a break station, which means during this particular station, you do not have to do anything. This is when you get a snack break or a water break or even a washroom break if you require. Another thing I need to talk about is the timer and the timing of this exam. So each station is 8 minutes long and the total exam's duration is 3 hours long. So before you start a station, you are given certain time, that is 1.5 minutes or 1 minute 45 seconds depending upon your center. And after that 1.5 minutes or 1 minute 45 seconds is over, a timer goes off and it says enter. As soon as you enter, you see your examiner, you greet your examiner, mention your name and GMC number, and you proceed. Now, at the sixth minute of the station, the timer again goes off saying you have 2 minutes remaining, which is like a warning shot. And after 2 minutes, once it reaches 8th minute, it will say you may now move on to the next station. And that's when you exit out of the station and you move on to the next door where you read the task. And this time from you may now move on to the next station till the time of the next enter is 1.5 minutes or 1 minute 45 seconds. Now let's talk about what is expected out of you during the examination and what you can expect on the day of examination. They expect you to demonstrate the competency and capabilities similar to that of a foundation year 2 doctor, which is a junior doctor. So just like how a junior doctor would handle his or her patients, manage, diagnose and treat, that is how at the same level they would expect you to do it. They wouldn't expect you to do a consultant level diagnosis or a consultant level treatment or management. What you need to demonstrate is you are an efficient doctor, you are taking decisions which is at your level, that is as a junior doctor, and most importantly that you are a safe doctor, that you wouldn't take any decisions which would put your patients in danger, that you would always check with someone if you are not sure, if there's always that you would put the patient's safety first more than showing your knowledge. Now on the day of examination, you will be asked to report to the building at a certain time. You, along with the other candidates, will be taken to another room where you would be briefed, offered some snacks, coffee. It's literally a meeting to calm your nerves. And then you will be assigned numbers. These are your station numbers. So an example would be, I'm maybe number 5 and the next person is number 7. Remember, these numbers are assigned to you at random. So because I'm 5 and the next person is 7, once we go into the exam halls, which contains all the cubicles from 1 to 18, I will be standing outside cubicle number 5 and the next person will stand outside cubicle number 7. So for me, cubicle number 5 will be my first station. And once I come out of it, my second station would be cubicle number 6 and so on. So I keep on going from 5, 6, 7. So that's station 1, 2, 3. For all that you know, a person may get cubicle number 8, which is actually a rest station. So his station may actually start with a break. Now, when you're standing outside the cubicle, there will be a paper attached to each cubicle where it describes what is the scenario, where you are, what your patient is, and what is the task that is required of you. So you are given usually around 1.5 minutes to read this question, understand the task, formulate a plan in your mind before which you could enter. So after 1.5 minutes, it's usually 1.5 minutes in square and 1 minute 45 seconds in street, because a street is a little more bigger building and it takes some time to go from this thing to another. So after 1.5 minutes, there will be a timer which goes off and says enter. As soon as it says enter, you go inside the room. Now let's talk about what is inside the room. Usually, this is a general rule of thumb. There is you who enters into the room, who is the doctor. Secondly, you have an actor who is the patient. Thirdly, you have an examiner who will be far away from both you and the patient, who will be quietly observing you about how you deal with the patient, how you manage the patient, and all the other things. And the examiner will not interfere with you at all. The examiner will try to stay out of your way as much as possible. They are not at all interested in talking to you. They just want to merely observe you. All your communications, questionings, everything should be with the patient. Now, like how I mentioned, this is a general rule of thumb. There are slight variations. You as a doctor will always remain. Sometimes you have an actor who is an actual human being who would act like a patient, or sometimes there may be a telephone phone where you pick the phone and you have a telephonic consultation where you have a patient talking to you through the phone. Or you may have a video consultation where you have a screen in front of you and the patient is on the other side and you talk like this. So 3 possibilities, either an actor or a telephonic consultation. Again, it's the patient. Third would be a video consultation. Again, the patient. It does not matter how it's carried out. The way you approach the station would be the same. Now, examiner-wise, usually you do have an examiner in the room. However, even if you do not see an examiner in the room, you do not need to panic, because sometimes there may not be an examiner, but there will be a video camera through which the examiner will be seeing you. They will be remotely observing you. So that is also a possibility. But do bear in mind, this is a general rule of thumb. Now, if in this consultation you are asked to examine, please never approach the patient. You will be given a dummy or an anatomical body part. So maybe you will have to cannulate the patient. You will just ask this patient, hey, can I cannulate you? Is that all right? You take the consent and all from the patient, the actor, but the procedure will be done on an anatomical part. You do not go and prick the actor. You do it on to the hand, the anatomical hand that will be kept on the table. So depending upon the task and the station, things can change, but this is the general rule on how it works. Now let's talk about the marking criteria. First, you have the data gathering, technical skills, and the assessment skills. All of them come under the first domain. Second one is management skills. Third one is IPS or interpersonal skills. So you have these 3 domains under which you will be marked. Each of this domain is 4 marks. So 4 marks in data gathering, 4 marks in management, and 4 marks in IPS skills. That is the maximum. So altogether, per station, you have 12 marks, out of which it is distributed into these 3 categories. There are 2 criteria to pass this exam, and you have to fulfill both of them. One is you score above the passing mark of the exam, and the second one is you pass 11 out of 18 stations. Now, in each exam, as in morning session and afternoon session, the exam score, the passing score is going to vary. And this depends upon the average of how everyone's performed. So that can vary, and it can be anywhere between 98 to all the way up to 112. If it's a batch that's performed really well, it can go even higher. So the passing score from a person today and a person tomorrow will be two different passing scores, and it not necessarily be the same. An example is, say you pass 12 out of 18 stations and the passing mark was 100, but you score only 98. You haven't cleared the exam. It is important that you fulfill both the criteria. To pass this exam, you will need to have 11 out of 18 and, above 100, say, considering that as the passing mark. So let's talk about each domain slightly in detail. First one is data gathering skills. This also includes your technical and assessment skills. What it simply means is your history taking abilities. Are you taking the right history required to reach a diagnosis? Are you ruling out all the differentials? Are you thinking of all the possibilities, and are you asking the questions relevant to reach a diagnosis? Are you asking about the risk factors? Are you taking a proper history? In technical skills, are you doing the right procedures? Say the patient comes with a chest pain, are you properly having a look at the patient's chest? Are you listening to the chest sounds? So, are you doing the right examination to reach a diagnosis? Then, are you ordering the right investigations to reach a diagnosis, or are you just ordering all random investigations? Are you ordering the required investigations? Are you suspecting the right thing? So this would be your data gathering. You are gathering data, you are doing things to reach a diagnosis. Then comes your management domain. Say you reach a diagnosis, now what? Let's assume a patient has MI and you have reached the diagnosis. Now you need to manage this. So in management, what all comes? First would be, you talk to the patient. You need to tell the patient, hey, it looks like, you are having some problem with your heart. You need to explain to the patient what myocardial infarction is, right? So you break the news to the patient. Secondly, it would be, okay, don't worry, we are going to manage you. How? Talk to the patient on what we are going to do for you. Now, another thing what they expect out of you is, they won't be expecting you to take the patient and put a percutaneous intervention or do a PCI stent. They're not going to expect that out of you. What they expect you is to manage the patient in your level. So at your level, what can you do? You can give him some painkillers. You can start the patient on oxygen. So you can say this, I'm going to give you some painkillers for your pain. I'm going to start you on oxygen. And then the other things would be later. These are things we will be doing for you. We may have to start you on some anticoagulation, and we may have to do some stenting if we think it is appropriate. So these are all future plans. These are things that is not at your level. That is a consultant level thing, a senior level thing. At your level, it would be oxygen, pain management. But to show that, hey, I know what comes in the next, you're just going to inform them that these are things we would be doing for you. Right now, you seem to be in pain and you seem to be breathless. So we're going to do this for you. Right now, I'm going to do this for you. So that is your management skills. Then you have your interpersonal skills, which, trust me, is very important. It's something most of us, if we are not from the western part of the world, lack. Interpersonal skills simply mean building a rapport with your patient. How you talk to your patient, how you approach a station. Are both of you having a wonderful dynamic, So say, it shouldn't be like, hey, what's your problem? Okay, do you have that? Do you have this? Okay, whatever. Okay, move on. It's not like that. It's all about, hello, how are you? What can I call you? It's all about making your patient comfortable, listening to your patient, involving your patient, addressing your patient's concerns, considering their problems, and being very professional, asking questions not in a very abrupt manner, but in a very communicative manner. Literally, interpersonal skill is pretty much communication. This entire PLAB 2 examination is mainly, more than your knowledge, what matters here is communication, which is why even though interpersonal skills are given 4 marks, it's something most of us lack. So for us, I would say focus on communication. So PLAB 2 is mainly an examination which is actually going to test out your interpersonal skills, where you learn how to communicate, you learn how to break a news in a nice way, you learn how to manage them in a very calm way, in a way where you just don't order them, but you talk to them. It's a two-way communication, right? So that's what PLAB 2 examination is mainly about. Mainly, this is what PLAB 2 is all about. To recap, PLAB 2 is an OSCE examination. It does test a lot of things. It tests your interpersonal skills, your management skills, it tests your data gathering skills. Mainly, it is an examination which really focuses on your ability to communicate with the patient. It's a very patient-centric approach. It's all about the patient, managing their concerns. So that's it, guys. Mainly, this is what PLAB 2 examination is all about. To recap, it is an OSCE examination held only in UK. Before you book for your examination, bear in mind the visa processing time and the fee of the examination. It is an examination which is going to really test your communication skills. It is going to mark you according to your management skills, your data gathering skills, and interpersonal skills. But mainly, it is an examination which really revolves around the patient. It's a very patient-centric approach. So I hope I have covered most of the things associated with PLAB 2. I'll try putting up another video on how to prepare and how to better your scores. If you guys have any questions or doubts, please do comment below. And if you want anything else, do let me know. And for any further details, you can always refer to my Instagram channel.